episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor. Welcome everybody again to another episode of our show with another really fascinating guest helping to create a better tomorrow on many different fronts. Today we have the honor of being joined by Dr. Bonnie Offit, who is currently the Chief Digital Health Officer at a tech company called Self-Care Decisions, which has a really innovative online medical system tracker and triage system that enables healthcare organizations to provide self-care decisions to their patients and their plan members. She also served recently as clinical advisor for digital health at the Children's Hospital Philadelphia, known here in sort of the local areas as CHOP. Dr. Offit has been a general pediatrician in both primary and urgent care settings for more than 30 years, and she's combined her clinical experience with her passion for using a variety of different technologies to solve healthcare problems while working at the time at CHOP's digital health team. After gaining personal experience as a telehealth provider, she learned the value of video and digital health firsthand. Highlights of her work previously at CHOP include implementing a free school telehealth program in an underserved school district, running various telehealth pilots, and participating on several digital health products, including store and forward dermatology e-visits and symptom trackers. When the pandemic hit, Dr. Offit helped scale telehealth in various departments at CHOP, including primary care, urgent care, specialty care, and surgery. Outside of CHOP, Bonnie's very busy as well, having experience in starting small businesses, including several frozen yogurt shops, a cafe, a food truck, a local magazine, and most recently, a company called Murphy Cares, which offers really novel type of digital health pet therapy, and we're going to get into that. Dr. Offit received her medical degree from the University of Virginia and then completed her pediatric residency at Children's Hospital Philadelphia and received a certificate in health informatics from Drexel University. Dr. Bonnie Offit, thanks for taking the time to come on the show today.
Thank you, Ira. Thanks so much.
Yeah, it's a really exciting set of topics. I'd love to start out like we typically do by just handing you the floor for a little bit to talk a little bit more about yourself and your background, just everything from where you grew up to how you got interested in medicine and health, and ultimately a little bit of how sort of your interest and passion for digital health transpired over the years.
Sure, I will do that. It's just always a fun thing. Yeah. So a little bit about myself. I'm actually from Virginia originally. As you said, went to University of Virginia Medical School, and I was really most of my career a general office-based pediatrician in suburban Philadelphia after training at CHOP, and raised my family. Actually worked part-time through most of that, interestingly. And as the kids were getting older, these things kind of came together and probably in that midlife crisis that people referred to as I hit around 50, I thought, there's just a lot more out there to do, and this is the time to try it. So I made a really big pivot in my life, and that's when I got into the frozen yogurt shops and the food truck and all that sorts of thing. But I also, through all of that, have always been very, very interested in technology. And so my kids can attest to this, that we were one of the first homes to have our wireless network and had those huge towers, many sets of huge towers that went into my attic that I had trouble disposing of. So every time there's a new technology, I'm there to purchase that and learn how to use it. So that sort of worked out that after my general pediatrics career, I found my way back to CHOP, what I call the mothership, where I had trained, and I had dabbled a little bit in telehealth. Now we're talking about 10 years ago, and I thought, I don't know why CHOP isn't trying this. Why aren't they getting into telehealth? And I put myself on a panel of one of these commercial telehealth companies as a pediatrician in the state of Pennsylvania. And I did some visits, and I didn't think I would like it, which I can get into later, but for many reasons, just my sort of the way I practice medicine. And the truth was I loved it. I got totally hooked and thought, this is definitely going to be an important way of how we see patients in the future. And I'd like to be a part of that at CHOP. So I just went over there, made appointments with people and to see what CHOP was doing, and just found my way and basically pushed my way into that role. And so we were plugging away at CHOP, really two of us. I was with Kate Fuller, who's the clinical lead of telehealth over at Children's Hospital. She doesn't have a clinical background, more of a tech background, and she's phenomenal. She set up telehealth, helped set up telehealth over at Jefferson first, then went to CHOP. And so I became her clinical sidekick. And the two of us were just kind of plugging away, doing little pilots at CHOP. You know, it's always frustrating with innovation. It was kind of going slowly, but that's okay. You know, I thought, oh, well, this is a job that I can imagine having for the rest of my life, because it's going really slowly. And, you know, just to have that culture change from physicians and nurse practitioners to provide it, as well as patients to seek it out. And lo and behold, COVID hit. And Kate and I were just sitting there in the driver's seat thinking, oh my God. So it was quite a ride. We scaled it enormously and quickly with the help of many others at CHOP. And that's what I did really for the past 5 years. And I guess what happens to people that make these kinds of career changes, as much as I have loved that job and did so much, I felt an itch to try something else. I now have that kind of thing that maybe people in this world feel, that it's kind of the frustrating parts of starting new things. I think I got hooked on that. So that was why I've shifted gears and just very recently started with self-care decisions. So now I'm going to stop there. I'm sure there's more, but that's me in a nutshell.
I appreciate that background. And, you know, I think, you know, thinking about that aha moment that you had, I think, you know, probably a lot of clinicians and practitioners might have had that moment. I sort of sit here, I'm not a clinician, but I do have 3 children. They're older now, but I can remember those days where, like, wow, yeah, this is definitely strep throat. Well, you have to come in the office. I'm like, why? You know, there's some things here. I don't want to. It's great. I don't mind going to the doctor. But come on, what's been your experience? You know, you had your aha moment. Where are we? Because we have these technologies. It just seems they've been a little slow. Obviously, things have ramped up now with COVID and the world changing as it has. But what are some of the trends that you've seen in your own practice, and then obviously your consulting, your relationship with CHOP, and so forth, with seeing the adoption of these tools with your colleagues and other folks that you hang out with?
Mm-hmm. Yeah, I mean, I think with medicine, I've been doing this for so long that I feel like I can see sort of the big picture, the trends that we've seen. You know, in my generation, we weren't living next to our parents. We didn't have the grandparent to help us with these medical decisions. And over the course of my pediatric career, I found that parents just constantly needed reassurance and needed to come into the office a lot for just little things. The first fever, everything is just a panic, and especially in pediatrics. And so there was definitely a place, you know, where we just need to educate. We don't always have to do a full physical exam for every single ailment that comes upon us. And at telehealth, as I sort of began to think about it and use it, it is absolutely not for every visit. And in fact, the example you use, although it's a good one and your instinct is, you know, you think your child has strep throat, the truth is for that you need a swab. The ideal situation is you need to come in until we have some other, you know, newfangled way of home strep tests, or, you know, the mobile cart that comes around to your front door, you know, to do that. But
you develop
everything
that next.
Else, that's right. But until that, you're that one you were stuck with, Ira. But there's just so much we can do. It's so many of the visits are reassurance or just a quick look at the child. We don't always have to look into the ears and listen to the heart and do the physical exam tools. The other thing I've seen over the span of my career is the less of a reliance on the physical exam. You know, for better, for worse, we do a lot of testing now. We get the chest x-ray if we think it's pneumonia. You know, we just do testing. So that for everything else that we don't need a lab test or a radiological study, we can probably do a telehealth visit. So tons of follow-up for specialists. How is the medication working? You know, side effects. Just talking to your doctor. And the other frustration that many parents have, which I'm sure you had, is that trying to get in and a phone call just to get in, just to get to schedule that visit. So those are that isn't telehealth per se, although it could be. Those are other projects that I worked on at Children's Hospital. And that's sort of through the EMR, the electronic medical record, to be able to self-schedule a visit. I think there are many, many reasons why we've been very slow, why healthcare has been extremely slow to get with the digital, technology growth like other industries. But mostly it's the fear of doing something wrong, or the fear of missing something, or the fear of a lawsuit, which shouldn't be it's not really the issue. It's really just the issue of not, being a good doctor and not helping the patient correctly. So doctors, like it or not, had the experience of finally doing this in COVID. And I think that helped a lot. They saw how much you can really evaluate someone by seeing them just even on a screen. Yeah.
And continuing along that path, obviously, this stuff, these things, and I don't have a smartwatch, but capable of doing so much stuff. Obviously, when you take the fear and the lawsuits, whatever, out of it, what are some of the areas that you are personally most excited about, sort of looking out? Obviously, maybe tools that you see currently, or things that you think about. Wow, we could create X, Y, and Z that you're most excited about in the coming years.
Yeah, I have a definite pet favorite. It's a device. It's a home, a peripheral tool, or home, stethoscope, otoscope device that I have used, and I really believe will end up being in everybody's home at some point. I don't know if you remember the evolution of just those thermometers,
Sure.
that you just, first it was the ear thermometer. Now there's the touchless. I mean, those are just technologies that are now inexpensive and everyone from diverse backgrounds can afford. That's where I see there's a tool, the company's tool that I have used the most and know the most about. I don't know if it's the best, but something called TytoCare, TytoCare.
Okay.
And that was what we used to do the school telehealth program. So instead of me just doing a FaceTime like we're doing, or a Zoom call where I can see you and I can probably have you take your phone and flash and see your throat, and I can do a few things. This is this little device, a handheld device. Wish I had one to show everybody, but it's great to see the eardrum. Great to focus, and a bright light on the back of the throat. It's a great device to look at a rash and really focus in well. So I see it on my screen. It fills the whole screen. I can do a heartbeat. I can do lung sounds, all with this one device. Well, actually, it's also a touchless thermometer. So anyway, I mean, that technology is here. You can go to Best Buy, buy that. The problem right now in this area, in Philadelphia area, you buy that, I don't think there's any doctors that you can connect to, except for me on a pilot. But we haven't set that up in our area. No one's really done that or used it as a pilot. I've been working on CHOP to do that, with their urgent care, just a pilot. It's not affordable for everybody. I think it's like $300 right now, but it could be subsidized. It could be for patients that have very complex, children with very complex health conditions, that could be given to a family and avoid some of the visits where they have to come in and bring the oxygen and bring the G tube and all these things. Wouldn't that be nice to do a few of those visits at home? It would pay for itself. It would make sense. So those are the kinds of pilots that I see happening not too distant future.
Got it. And along the lines of sort of the global scenario, you've been involved in a consortium called Kids X, which has brought together various children's hospitals from North America, Europe, Australia. What are some of the trends that you've seen? How do we in the U.S., obviously Philly, we're maybe a little slower, but how are we stacking up to some of the other parts of the world in terms of adoption of some of these tools from some of these relationships that you've seen in other countries?
Yeah, that's been a really exciting program. That's been out of Children's Hospital of LA, and they're one of the more sort of digitally progressive children's hospitals. So they started, and this was I think the second year that they had this accelerator that you described, this Kids X accelerator. So it allowed people that are just plugging away and figuring these great ideas amongst themselves to all come together and to try to have an open door to children's hospitals to pilot their ideas and their apps. So I think they got 300 applications, worldwide. They narrowed down to like 100. And then each hospital had to sort of narrow down to 10. And then we piloted, CHOP made a decision to pilot like 1. So it was, through the process itself was really great. So we learned about all these we had pitches from all the different companies and learned about what's going on out there. So that's hugely valuable. We also got to meet, and I got to meet other, people from other hospitals in a similar position that I am, to see what they're doing in their hospital. So we could collaborate and not compete. It's like the Chamber of Commerce, for digital health in children's hospitals. So that it has been a very valuable experience and will continue to be. Here's one of the roadblocks in that area. So these are all these kind of mobile apps. So here's an example. There are these great mobile apps where, let's say, a child psychiatrist might see a patient, and then in between visits, let's say, they diagnose an anxiety disorder in a teen. But in between visits, they say, I want to prescribe this app, put on your phone. And it's an exercise that you can use. You can use this app to sort of help you deal with your anxiety for the month, and then I'll see you next month. So it might be in between your own personal therapy that you prescribe an app that these ingenious people have figured out. So Children's Hospital would buy a license to that app, or better yet, the insurance company purchases that app. And then so we can prescribe it almost like it's a therapeutic. It's really called a digital therapeutic. So they're all out there. No one can figure out how to pay for them. And then the second problem, that's the big roadblock, who's paying. Second problem is it's integration with the electronic health record. So there's loads of these apps that kind of sit on their own. They're really functionally on their own. But if I'm a provider at CHOP and I have a couple patients using this app, couple of that, I have to go outside to my platform to see how my patients are doing on that app. And then I might have several platforms that I've got to log into in a day. However, if I can see it all, if it can all come filtering through my electronic health record, which at CHOP, it's Epic, that works really well. Then I can see everyone, what they're doing. If I get alerts, something escalates, it all comes through. So we have, and many hospitals have just been kind of waiting for Epic to just keep developing these tools, or that would be the very best way. Let those companies go to Epic, let Epic, I guess just share them with their clients, and hospital systems, and use it that way. And we haven't seen that happening yet, but that would be my dream.
Really. Let's talk about Murphy Cares, because this is another one of your ventures. Really fascinating. And we've about a year ago, I spoke to a researcher at the University of Denver on sort of the animal-human bond and sort of some of the benefits there, reducing stress and blood pressure, and actually reducing recidivism and sort of troubled youth. You've created this platform, it's a digital pet therapy with we're not a dog family, we have birds, but love pets, know the importance of this bond throughout a lifetime for various services. Talk about Murphy Cares, how you came up with the idea, and a little bit what you're doing there.
Yeah, so that one I give all the credit to a colleague nurse friend of mine named Michelle Davey. Okay. And Michelle has worked at CHOP for many years, and she had this huge idea. She's been a nurse innovator and had lots of successful innovations to date. This one was like, she calls me one day and says, "Bonnie, what do you think of this?" And she tells me, and I'm like, it was in a different format, and I just couldn't even wrap my head around it. So I don't know, Michelle. But I've also, for better for worse, don't say no very often. So it's like, okay, let's talk about it. So this is a couple years ago already. We haven't gotten very far, but the idea is still a really good one, and it's one of the reasons that we haven't gotten very far is no one's really tried this before. But so we like you said, we all know the benefits of having a pet in our lives. I mean, there are some downsides too. Could be some infections and weird stuff, but for the most part, bites. I mean, there's some bad things, but for the most part, pets in our lives have just been extraordinarily positive. And we also know that people love, including me, just looking at, just for like a minute or 20 seconds, some videos of animals. I mean, just doing goofy things, cool things, loving things. It's just this like incredibly relaxing thing. That for me is almost the way that I can relax the most. I mean, there's a million other wordscapes and, solitaire, and we all know music, but there's something about watching animals. And so we have a prototype. So anyone can go to the Apple App Store. It's not on Android yet, but on the App Store, you can search Murphy Cares and you can find our little app, and it has 2 dogs, and it's pretty rudimentary. You can call it demo, prototype, version 1, whatever you want to call it. That's what it is, because that's all the money that we had to really do it. We used we put in a little personal money, and we did wireframes. We've gotten to this prototype. We decided to put it in the Apple Store just because it was kind of good enough to just try it. And it also was a good way for us to share it with people. Whether just to use it during this, horrible year and a half that we've all been having. And secondly, to see if we could find, somebody interested to invest, because we're at this horrible, horrible state of every startup. We need funding to really make the app. And our hypothesis is that we can get these video clips, put them in a platforms in such a way that, your interaction with them, even on your camera, because they're videos of real dogs, you see their face, you interact with them. It might be slow motion, whatever it is, some noises, but you have that moment. You have that really warm feeling you have when you pet your dog or you come home and see your dog. There's no way it's ever going to be the same. No one can, you can't recreate the fur and the hugs and the wet smooches and the whole thing. That can't be recreated. But we thought we'd give this a try to see. Everyone goes, there's loads of libraries of animals that you can go on Instagram and curated libraries, but ours was a little different, where you can like throw the ball, you feel like you're walking the dog, and we put a little bit of music in the background. And we captured a little bit of it on the prototype. We have a long way to go, but it's definitely doable. And there's enough science to where we found some research showing that people watching these videos, obviously it's just like this relaxation. I mean, it makes sense. Sometimes you don't need science to prove the fact that we know how most people feel. If you don't like animals or it doesn't work for you, so be it. But for many people, I think it's a good idea. So we'll keep plugging away, see where we get. But that's definitely a little side project that I've been involved with.
I think it's really cool. And as a side note, I even though we have birds in the house, I love watching owl videos. I don't know why, but it's just, anyway, if you want to go put some owls on the system at some point,
if you get an owl, Ira, we'll use your owl to star in our app.
But talk a little. I mean, obviously you're a clinician, a futurist. You're an entrepreneur as well. One of the interesting things I saw in your bio is the fact that I think a couple of years ago you were involved as a startup out of the down the street here at the Pennovation Center at University of Pennsylvania. And I'm a very strong believer in all things life sciences here in Philly. I think we have multiple Silicon Valleys here in Philly. They're just waiting to pop out, from everything going on at Penn and Drexel and Temple and down here at Jefferson. Your experiences in sort of the incubator over there, how do you think? What grade are you giving Philly right now in terms of developing the sort of this technology transfer and sort of spinning out companies? Too often I've seen companies, are great technologies, fly away to other cities and not stay in Philly. In your experience at the Pennovation Center, how do you think we're doing today?
Yeah, and I think the Pennovation Center is the key place, and I think University of Pennsylvania, that started Pennovation Center, and the relationship is the best we have. There are certainly lots of companies that are coming to this area. There's loads of talent coming out of our regional education centers. I guess it's really hard to recreate what what Silicon Valley has done. But like Austin's big. I mean, there's just a lot of other cities that are popping up that are, I think, and I feel like Philadelphia isn't far behind, if not all. There's some, like, there's a lot of these venture capitalists that are getting involved. There's a lot in this area. The Ben Franklin Partners. I don't know. I feel really good about it. Temple. We found Temple had an innovation center and giving small business advice. You can find things. You have to dig and dig, but it's definitely in Philly. So I don't know. I guess I would give it an A-. My personal experience with Murphy Cares, we were selected to be in one of their summer innovations, and it was a phenomenal experience. I learned so much, and just the environment was very conducive to meeting people. It reminded me, because I just recently watched that We Work movie on Hulu. So it felt like the concept they were trying to get at actually was happening there, and it's very successful. So you kind of meet and you work, and then at the end of the day, you gather around some soda and some beer and wine and talk about it, and they bring people in to meet that you might need along the way of trying to do a startup. So it was all there. And then there was rental space. If you got to that point of ever starting to actually monetize your idea, you could rent space there and continue to work at the Pennovation Center. So I thought it was great, and hope other people will keep trying. And they've definitely had major successes on companies that have started up out of there. Yeah.
I agree with you. One of the areas I want to get involved in, and a little over a year ago, I had the opportunity to spend some time on a different platform with Dr. Victor Zhao from National Academies of Medicine. And one of the areas that he was really hot on, it was a very important theme down there, was physician burnout. That, this is a tough job. I take my hat off to you. It's a tough job. Not saying that you're burnout, but any means. You practice medicine, but you're also an entrepreneur. You're involved, aside from all that, in seafood products and a magazine and some other stuff. Putting that aside for a moment, what do you see with some of your colleagues and the folks that you've come up with? Do you, based on your own experience, do you recommend, like, if someone's feeling, wow, this medicine stuff isn't for me anymore, maybe go out and open a yogurt stand or start a magazine, take a little break and come back. It's still there for you. Or what are you experiencing in your sort of social circles in the medical scene, based on your experiences, sort of leaving it and coming back?
Great question. Great question. And I'm totally a victim of physician burnout, but also it depends on the person. I'm sure there are people that go into medicine that might be more apt to be a victim of the burnout. I blame the burnout, for me personally, completely and 100% on, which is really ironic, but on the electronic health record. So here I am. I love tech, love the EMR, lots of aspects. And I feel like a hamster in a cage when I'm typing and I can't find the drug, and I'm typos because I never learned to type. So my age group is just not native on computers, and I'm pretty good on computers. I'm just not a native typist. And it's a huge problem. So whenever I do shifts, I did primary care, and then I worked actually at the CHOP emergency room and urgent care. And I don't know what percentage of time, but it's got to be like 30% or more of when I do my shift that I'm on the computer trying to find things in Epic, trying to just log in and find, go to do all my stuff on the computer. And I liked the old days. I had just a paper chart and I scribbled a couple things. I didn't have to write a whole review of systems, which is when you're asking people whether, if they have other symptoms, and you had to document that. We didn't have to do any of that. We just put what the pertinent positive, what was the assessment, what was the plan. That was that. So the documentation has absolutely drove me to be looking for other things. So part of my passion is to make life better. There are loads of innovations coming down the pike to make that better for physicians. Now, I think the young people that are, just out of, number of years out of residency or, medical school, that's all they know. So they'll learn to adapt. They'll learn all the tricks. They'll become great typists. I'm not sure they'll have the same problem, thank goodness. So are they getting burned out just on the actual, medical aspect of their job? I don't think so. I still look at medicine as being one of the most honorable, most amazing fields. And I wouldn't have done it any other way, because when it comes down to it, you're just, you're one-on-one with your patient and trying to help them. And there's just no greater feeling. There's nothing better than that. So it'll always be a great profession. And I would never discourage people, to look for something else. I don't know exactly what happened to me. I mean, I'm still in medicine per se, but if I were asked, could I go back to working, 4 days a week and my shifts the full day and seeing patients, room to room to room, I feel like those days are in my past, but I constantly give people advice. In fact, I love giving my cell phone out. Everyone knows me. I said, I'm happy to get clinical questions day and night. And so for family, friends, or whoever else, my husband, whenever they ask him, even though he's a pediatrician in infectious diseases, like, you need to talk to my wife. He always, punts it to me unless it's specific to his area. So I feel like I'm still a clinical pediatrician in that way, but just not the office space. I think things will get better. I think, I don't know. I think we just need to do a lot more voice dictation and just not having our fingers on the keyboard. And I think as a patient, I've certainly gotten used to if you go in to see a doctor and they're just sitting there talking about and dictating, they're saying, I'm seeing Ira and his left eardrum looks good and it's right. And all that's just going right into the medical record. That's the future. And I think that's okay with all of us. And that will reduce that burden of documentation and that burnout. That's what I think.
Bonnie, we talked about a lot of things that you're doing, both on the medical front and the entrepreneurial front. Any new stuff? Anything coming down the pike? Any scoops that we can announce here first that you want to talk about? Please take the floor.
I'll give me a moment. I'll talk about my new gig, which is with the Self-Care Decisions. And the reason I decided to try this one out is because I totally believe in the tool. So it's basically the competitor to Dr. Google. So what do we do? We have you got like, my ankle's killing me. My left ankle hurts. What do? You go online. What do? You search stuff and you get some good sources, you Mayo and Cleveland Clinic, you get WebMD. I mean, there's lots of good resources out there, but you get lost. You start going down the rabbit hole, and the next thing, what do you have? You have cancer. You have bone cancer in your left ankle, and it's like totally stresses you out. So this symptom checker that the team that I just joined, actually, the reason that it works so well, it's not because it's terribly fancy or has this incredible, user design, but it has great content. And it's been written by a famous doctor who's in his 80s now, Dr. Barton Schmidt, who's a pediatrician from Denver Children's. And he has curated this incredible content over decades. All the nurses at CHOP, for example, and many, many hospitals around the world use his content for telephone triage. So when you call these telephone nurse lines, whether you're a nurse fresh out of school or an old seasoned nurse, you have this material right here, and you have the questions to ask, and it sort of guides you whether you need to seek care now. What could it be? It's red, or is it yellow, where you need to get care pretty soon, or you're in the green zone where I can give you some great tips of home care. So what this the company that I joined has taken all of that content and put it in a digital format. So you can just go in and you go to, a human body, a homunculus, and click on your ankle and a couple things. It's not a load of questions. It's quick. It gives you what kinds of things you can be doing, what to look for, and what level of care might be appropriate. So it's kind of the first step you do of home self-triage before you call your mother, or you call your grandmother, or you call your doctor, or just worse yet, just go straight to the emergency room, which a lot of people do. And it's fine, but it's not necessary in so many cases. But I think I read a statistic where, especially in pediatrics, about it was like 90% of when you go to the emergency room with a child, you're sort of seeing a discharge really quickly. So there's a name for that, but it basically tells you didn't need to go to the emergency room. It's like 90% of the visits. That's just really high. Not so much for adults, but for, we're very nervous with our kids, and we just sometimes don't even want to stop to call our general pediatrician, or we don't have the patience for waiting for a call back, and we just go because we're scared to death that we'll make a bad decision. So anyway, so that's, I think, a really great tool. It's kind of the first step. We call it like the digital front door. What's your first step to do with a medical problem? And we'd rather, instead of going to Dr. Google, just go straight to a trusted, source of information. What this company does, and it will go to a place like Children's Hospital and have them kind of license it. So it will be on, if you have a CHOP portal, we call it My CHOP, you would go on and you'd find that symptom checker right there, or you go on to the web page. In fact, it's on there now. I'll put that plug on. They're demoing it now. On if you go to the primary care page or urgent care, you scroll down a little bit and it says symptom checker, so you can try it out and demo it. And even if you go to the website, you can demo the device, but the tool, I should call it. But anyway, so that's what I'm into these days.
Very cool.
Yeah.
Very cool. And we'll put a link to all this in the bio write up. But really exciting stuff, Bonnie. I enjoy sort of these convergent stories, that bring all of these different themes together. And I'm really wishing you the best with all this and all what you're going to be doing, what you're doing now, moving forward. For everybody that's going to be listening to this particular episode on the podcast or watching on our YouTube channel, you've been listening to Dr. Bonnie Offit, Chief Digital Health Officer at Self-Care Decisions, former clinical advisor in digital health at the Children's Hospital of Philadelphia. Google her, check out Murphy Cares and a variety of other her initiatives. Bonnie, it was a really great time talking to you. I want to thank you for taking time out of your schedule to do this. Thank you for what you're doing. And as we say on our show, thank you for helping to create a better tomorrow through your initiatives. It's really very inspiring stuff.
Thank you so much, Ira. This was just a great opportunity for me. I really appreciate you asking me to be part of this, and so I can share all this fun stuff with everyone.
It was a great time.
All righty.